Hello, everyone. Welcome. My name is Cassidy Diamond. I am the Associate Director of Public Programs and Events here at the IDA. Thrilled to have you all here with what is going to be a great conversation around Netflix's Lenox Hill, moderated by IndieWire's Steve Green. Before we get started, I would like to offer a brief land acknowledgement, as we always do here at the IDA. I am coming to you today from the IDA offices, which is on the unceded land of the Tongva and Chumash people in Los Angeles. They have been stewards of this land for generations, and I would like to acknowledge their presence here. I'd also like to thank Variety for being an amazing support and sponsor of this series. Thank you very much. I'd like to offer also a thank you to Mara here for assisting us here with ASL interpretation. Thank you, Mara. And we have a few more screenings left in the series, a few more conversations. You can go to documentary.org/award spotlight. To find out more of those screenings. And without any further ado, I'm going to hand things over to Steve here to get us started. Welcome, Steve.
Thank you so much for having me. I really enjoy this series, and it is an absolute pleasure to be able to talk to the people behind the show and some of the doctors who you have seen in front of the camera as well. So let's start things off by introducing two of the directors and executive producers of the show. We have with us today Adi Barash and Ruthie Schatz.
Hi. Hi, Steve.
Hello. Hello. Thank you so much for joining us. And then, as mentioned, we have two of the doctors who you've seen as part of Lenox Hill. First off, we have Dr. John Bokvar, who's the vice chair of neurosurgery. You've seen on the show. John, thank you so much.
Hi. Hi, Steve. Thanks for having me.
Yeah, and we have Dr. Mirtha Macri, who is a doctor of emergency medicine, who you've seen on the show. Mirtha, thank you so much for joining us.
Thank you for having me, Steve.
Yeah, so I feel like a great place to start off with this is where so many documentary projects start, and that's with trust. I feel like you don't get a show like this without a pretty clear understanding of where everybody is in this particular process. So what kind of conversations did you all have before filming, and what were some of maybe the tiny things that happened once the camera started rolling that helped really sort of lock in the idea that everybody knew where this project was going?
Well, Johnny, we initially met doctors from each department that we were thinking that their specific profession will be right for the show. And we sat in front of them and basically spread our beliefs and the things that we think are right for us and what we're looking for. And it was super honest and straightforward. So I think from very early on, and they can speak to that, they knew what we are striving to do in the show and how deep we want to go in. And luckily, we had really great partners that enable us to actually do that.
Yeah, Steve, I think that, first of all, that's a great question to lead. And I think you saw how we were sort of chuckling when the question was coming out, because frankly, in the beginning, I had some trepidation about being at a New York City hospital and being so transparent. Obviously, there's risk, but honestly, as soon as Adi started filming us and we realized that their intent was to protect patient privacy and patient safety and our privacy and our safety, it became such a beautiful work to work together and share these stories and the courage of these patients. In the beginning, before shooting, there was trepidation. As soon as the shooting started, it was like it was just a seamless, beautiful arc. So, it was just terrific.
Yes, I got to meet Adi and Ruthie before we started filming. They spoke to some of the staff members, and I believe one of the questions were, why do you love emergency medicine, or why you went into medicine? and we don't train to do this. I mean, I've never done this before, and I also had my hesitations. But after meeting them, I knew that there was a connection in our visions. I knew instantly, just meeting them, what either the energy they give, what they wanted to do with the show. And like John mentioned, as soon as the camera started rolling, it was very easy for me to just, I didn't feel like they were around me, when I was taking care of patients. Very non-invasive, and it was just very comfortable environment to work in. So.
Great to hear. That's great to hear. So for people who might be watching, Ruthie and Adi, this was not your first experience in making a project like this inside a hospital. I'm wondering if the two of you could talk a little bit about your experience in that before, and maybe how that you were able to use that so that you weren't tackling this kind of project for the first time in this context.
Yeah, so we've made our first show in Israel. It was called Ichilov, which is the biggest medical center in Tel Aviv, and also in the center of Israel. And we had a very strong connection to the hospital, and it was actually a place where we've been wanted to work for a while. We both had a personal experience at the hospital, which made it clear to us that this is an environment that nobody really showed. There are certain things in this environment that nobody showed in a certain way, and we wanted to expose this point of view of the doctors as we experienced it as patients. So it took us a while. We did a big research, and eventually we started filming there. And what we discovered is that, when you're making a show or a film in a hospital, you meet all corners of life, all corners of society, and you can tell a much larger story about life. And although it's a hospital, and obviously you'll meet a lot of medical issues, but you can tackle a lot of issues that they're so important and so big and even political through that prism. And we just fell in love with this ability, and also the ability to touch so many people in this microcosmos with life and death, which is basically what we experienced. So we had this experience in Ichilov, and we felt like we want to go to a wider audience. And then the idea of New York started, developing in our minds. And soon enough, we just did it. It wasn't easy, obviously. Healthcare in the States is particularly complicated, and patient safety is very, very high. And so we had to learn how it all works. We had to learn the system, which most of the people don't really know much about. Even a lot of the doctors don't know how it really works. So we had to really understand it in order to understand how to tackle that and what to avoid, and how to really build a structure that will allow us to go around and create this intimacy.
Yeah, I for John and Mirtha, I wonder if part of what made this project seem like an interesting idea is that I imagine that the two of you get a lot of misconceptions about what it is your job is day to day and what responsibilities you have. And I'm curious if the chance to sort of show people what it is that you do and the full spectrum of what it is you do on a day-to-day basis, if that kind of helped that process of letting Adi and Ruthie come in and sort of let the camera start rolling.
Mirtha, you want to take this one?
Yeah. So I mean, for emergency medicine, for sure, I think the population in general, the biggest question I get is, so what is the craziest thing you've seen in the emergency room? And, of course, the emergency room is a wide open door for everything. But I think one of the most amazing things the series showed people was that emergency medicine, yes, we train in the textbook medicine, we do the clinical rounds, we know the medicine, but it's not oftentimes as simple as just letting somebody go home or admitting them to the hospital. Well, a lot of, a big population in downtown Manhattan are homeless. We have a large mental health population, and the population that we serve is very diverse in New York City. So, practicing medicine and learning that diversity, learning how to be respectful and, culturally understanding of everything that's coming in through our doors. It's a challenge, and sometimes it's not easy. And I think the series really portrayed that very well. That sometimes we're not just the doctor, we're the social worker, and we're a family providing support to a family member. So it was really beautiful the way they portrayed that.
Yeah, I agree. I think one of the things that I was motivated to show was, there've been a lot of shows that we've seen brain surgery before, let alone on Grey's Anatomy. We've seen awake surgeries and very complex surgeries, but there's so much more. I like to say we move without the ball, meaning that there's so much play that doesn't involve actually touching the ball all the time. And whether it's the discussion with the patient pre and post-operatively, whether it's the clinical research that we're doing, the clinical trials that we're doing, the basic science research, dealing with administration, dealing with our wives, there's so many parts to the mosaic of our lives that to get the opportunity to tell this story. And I think, at least for myself, and I know for David and I'm sure for you, Mirtha, like just chronicling this and having it even for my children to see. I came home and, after my kids had watched the show, my son Nathan said, "Gosh, Dad, I had no idea you did that." So, it was just a great opportunity to chronicle our lives.
That's great. I imagine when you're trying to capture all of these things, especially when you're trying to get into very sort of closed and tight spaces. For Ruthie and Adi, what was your sort of rig setup like, and did you have to sort of adjust what kind of equipment you're using, knowing that you might have to get into some cramped spaces?
Yeah, well, the issue of trust involves with it. How can you be as less intrusive as you can when you're there, and then you do it in a way that you have nobody, or you're a two-person team basically in there. Obviously, the camera, whatever the way that we rigged it, had to be very precise, so we could be in tight spaces. We could hear their sound, because they're walking around, nobody's going to really wait for you. So you have literally a few seconds to hook them up to the sound, and then see if there's anybody else that's part of the specific scene to hook up as well of the sound, because you want to get that, obviously. But then it's the intimacy, I think, with the equipment, together with the trust, not only of the doctors, but with the patients themselves. Obviously, it's a doctor-patient relationship, but they graciously opened that door for us to be part of these super intimate moment inside rooms, very dramatic for the families and for the doctors themselves. And I think these two things together, trust, intimacy, small crew, camera that could capture it in the best way possible, gave us the opportunities to be part of it.
And I'm wondering for John and Mirtha, did having a sort of a smaller, it's not like they're coming in with 6 different cameras, getting everybody from all different angles. The fact that it was a sort of a smaller crew and less intrusive in that way, did it make that then easier for you to sort of work with patients and sort of explain to them what the process was going to be of sort of that having them in the room as well?
Yeah, for me and my patients in particular are challenged commonly with brain cancer. And so it is, and we have, small offices in our preoperative spaces and whatnot. So, that trust that we have with our patients and frankly, the loyalty and trust that they have in us. And, you know, when I would bring up to them that we're shooting the documentary and Adi's our cameraman, for lack of a better word. And they were so gracious and courageous and so willing to share. I would say 9 out of 10 times willing to share their story and sort of pay it forward, if you will. But having that single, if there was a big crew and a big setup and, you know, makeup and this, that, and the other thing, I think, you know, one instant they could have turned around and said no.
Yeah, and I think just to, you know, in order to catch these moments, and these are pure moments, none of them, you know, were prematurely directed. You know, there was a case, there was an instant. John would go, you know, either to the offices, walk around, obviously, the hospital, OR, Mirtha inside the ER. It's all, you know, for us, capturing these pure moments that, you know, suddenly ignite before your eyes because you have the ability to shoot them together with everybody. These are the moments. So, and, you know, I think it has so much power to tell the story and for people to connect to it.
And also, apart from getting this intimacy with the doctors, we also gain intimacy and, you know, strong relationship with the patients, especially John's patients, because they've been coming for a while and we've been capturing their stories and stayed in touch with them and got connected to them. And we were totally invested in their lives, you know, so everything devastated that had happened to them really affected us as well. So it was all, you know, it was, we felt part of this culture already, and we were totally embedded in that. So I think, you know, once you project these emotions from yourself and you identify with the story, so people relate to it and they trust you. They, you know, they know that you're for real and you're not there just to capture their story. You're actually also there for them. Which we totally feel like, you know, as filmmakers, as documentary filmmakers, we carry with us people, you know, from 20 years ago that we've been filming. And most of the people we film stayed in our lives. It's just such a deep connection. So it's part of what allows us really to go so deep.
Sorry, Steve. Go ahead.
No, I was going to ask for Mirtha, specifically for you, that you're not exclusively working with patients who you're just meeting. We see in the show that you're working with people, in some cases more than once. But I imagine it must have been a little bit more challenging for you to try to sort of make the idea to the patients that you're working with, given that you may not have that sort of pre-existing sort of long-term relationship that other departments might have.
Yeah, so you know, that was very challenging. And just to have an idea, you know, patients would be consented before they saw me. I mean, in the emergency room, you know, you get a provider when you walk in with a specific complaint. So I was just in awe about how brave these patients were to share their stories. They hadn't met the doctor yet. And it was challenging because we only have a few minutes to really obtain consent. I mean, I have to see them fairly quickly. So there was really only minutes to a yes or a no. And once they said yes, then, you know, they have a visit in the ER. There's a small population of what we call frequent flyers that we know because, you know, they're a population that comes to the ER when they're in need pretty frequently. But otherwise, I will never see these patients again. Probably. I can follow up with them if I'd like, but I thought that was very challenging during the filming. And it was great that so many patients, you know, wanted to tell their stories. And actually, after watching the series and working on the series, I realized that, you know, patients, it's pretty amazing, their bravery of wanting to tell their story on camera like that.
Yeah. I sort of, I guess, sort of going off that a little bit, for Adi and Ruthie, at what point did you want to, at what point did you know you wanted to go outside of the sort of the confines of the hospital and to sort of say, we like, obviously a big part of the story is seeing the doctors at work in their sort of in their professional environment, but to follow them sort of to other places as well, either in the immediate community around the building itself or just sort of in gatherings in other places as well.
Yeah, I think it had to feel natural for us that we were they're in a routine that they're doing every day. If it's John, if he's taking his ride back with the train home, so we knew that it's a daily thing that he does, and we were waiting for the moment that we could follow him after his shift ends in the day. With Mirtha, it was natural. She delivers her first baby, and she was at home. We wanted that connection just to see that she completely connected with her motherhood. But then there's this calling that in the ER that that she's missing. David as well, it was his birthday, so everything. And also, obviously, Amanda, which was her parents coming, part of her birth throughout the cycle that we went to. So it had to have a natural feeling to it as we were departing the hospital. And even in the first scene, when they go out, David goes out to the street, goes into the subway. It's completely natural. It's a daily thing. Okay, today's a good day, and John as well. Everything was just their daily routine that we wanted to follow.
And we always used it as perspective, so it always had to be part of the propelling of the story, and has a meaning in the larger picture of each one of them, in each person's storyline. With Amanda, it's a community that her parents is actually providing to her, and that's something that is very important to her also as a mother and as a physician that is dealing with giving birth and creating this something that was lost from the world, this sense of community and sense of support. So her family really exemplify what she was looking for, and it was beautiful to see it. Johnny has such a tight family connection that is something to look up to. And so the perspective of him and his family, and his funny conversation with Jody, his wife, and playing with his kids, is something so heartwarming. And same to every one of them. It always felt like a place where we need this perspective to show how they are caught up in this world where they are so they're so intricate. They go into all these small details, and then they have this minute where they can be themselves, released from that burden, and just be in life. And I think when you go out in the first episode, you can really sense it. Like you were actually in a whole world for almost an hour, and all of a sudden, oh my God, there's a city outside. People actually live outside, but you've been through such a roller coaster. You've seen life and death and what really happened here, but it's here in the Upper East Side, it's just next door. So it's always playing this like fine line of creating this roller coaster of emotion.
Yeah. And for John and Mirtha, I imagine that having the opportunity to see Ruthie and Adi in the hospital and see how they work, that must have made it at least a little bit easier to sort of go along with sort of welcoming the cameras into another part of your life.
Oh yeah, I mean they're commensurate professionals, and without that level of professionalism, frankly, I would have been very apprehensive about bringing them home. I mean, one of the funny stories that we had is we live up in Westchester County, and I guess Adi was filming my wife and I having lunch at a local yogurt stop. And after he left, my wife ran into somebody in Scarsdale who assumed we were making my daughter's bat mitzvah montage. So, it was just great. I mean, just the way they reacted, and again, like Mirtha said, just professionalism, from the beginning to the very end, and then some. And after the end, it's continued. As Ruthie mentioned, my patients they've communicated with the families of patients, deceased patients, continued to communicate. You can imagine that we've lost patients during the filming, and that the families then have to watch this afterwards, and just the you can't imagine the level of they were so grateful to have these lives again chronicled in this way. It's been overwhelming, literally 100% positive, 100%.
Yeah, I agree. Meeting Adi and Ruthie, just working with them from the very beginning, it was an instant level of comfort and respect, mutual respect. Never felt like I never felt uncomfortable really. Like I was pushed to do something or say something. It was just very natural. It was wonderful. It is still wonderful. I'm so glad I met them. They've become, a presence in my life, and I'm very grateful for having been able to do this.
Right. One of the things that I think stands out most from the whole series is the idea that families don't want to see blood on your shoes. It's such a small idea, and it's I'm sure that's not something that's taught in any textbook. But I'm wondering for Adi and Ruthie, how much were you trying to go for those moments that weren't necessarily sort of an explanation of the technical side of what these doctors do, but just the sort of the innate instinct of how to best communicate with patients and how to sort of deal with patients as human beings rather than people who are sort of separated from emotion.
Listen, the beautiful thing is that John, Mirtha, David, Amanda, they have insights into, it's not just their profession, it's their bedside manners, it's philosophical, depth into what they're seeing, how they're seeing. They're into details. They're outspoken. They're truthful, candid, and they have their own vision. And we, when you connect to characters that you want to hear them, they surprise you all the time. They're super insightful. And it's not just about the medicine itself, it's the medicine, the core, and what's wrapping it all the time and into the details. This is one of them, parents don't want to see blood on your shoes, and you catch it because John is, it's there if you're willing to see it. And I think that was one of the lines. There's many more, and Mirtha as well. So these insights give the audience kind of a perspective of what, how they're seeing their how they conduct themselves as doctors inside the hospital. And I think it's great, absolutely great.
I think that kind of goes back to we were talking about earlier about misconceptions and maybe what people don't fully realize about what for John, for you, John and Mirtha do every single day. How much did you sort of want to bring in those ideas to sort of show that this is an ongoing sort of patient relationship it's not just about sort of figuring out the exact scientific way to sort of treat somebody, that there is that sort of emotional layer too, and that sort of interpersonal layer too.
I think there's the special thing about them is that they give some sort of perspective. So we as patient, let's say, okay, or how we see the patients, they come to the hospital and they're very much alone, their family, they have to deal with so many things, and there's guilt, and there's shame, and their family can fall apart, and we were looking for these moments where they acknowledge that, and to see a doctor like John really acknowledge what they're going through and speak about it. It was something, and also Mirtha, all of them actually, it was very important to us to communicate it, so people understand that they're not just like some sort of technicians or those doctors that we know about, or the perception that we have towards doctors, but actually people that going into details and thinking about those elements that actually really affects everybody's psyche.
Yeah. And also, you know, the way what they give you when they express themselves like that is for us as documentary filmmakers, as artists, or storytellers, is they give us a chance to put pieces together in a way that, you know, for us is cinema. It's cinematic. It's not, you know, one-sided, two-dimensional, but it has many facets that if you capture it and if you find a way to tell it, the way that we envision it, then it has a structure that is almost scripted. That's how we love to see it at the end. You know, when you have all these pieces, it's like, you know, it's scripted. So having all these different layers and sayings and perspectives is a powerful tool for us, and obviously for them, the way that, you know, they're dealing with the way they're in the hospital and as doctors and human beings.
I feel like we should at least talk a little bit about the COVID episode, because I feel like that came out very early on, relatively, especially considering when we're talking about this now. How important was it for you to sort of get that episode and that footage out towards people to be able to see it right away? Because I imagine that must have been a difficult thing to work on and essentially turn around so quickly. For Adi and Ruthie, if you could talk about sort of the process of making it, and then John and Mirtha, the process of actually being able to sort of show what it is the two of you were going through at that moment.
Yeah, so listen, I was thinking about it today again. You know, we live our lives, we expect everything to be hunky-dory, everything structured, surprises that are controlled, and then suddenly you get this big whoa, what do we do, you know, from east to west around the world, and you have to prepare for it. You have to kind of go into the battlefield, literally. You know, these all these doctors were in a position where I think, you know, it was probably the biggest event in the last 10 years or since SARS, but even much bigger, and they knew it was going to come. So the way that they dealt with it was heroic in a way. It was their mission, but then they knew that they had to find answers for so many things in the way that they're conducting their medicine for their patient, for their departments, for themselves, for their families, just to figure it out. So I think seeing that from the get-go, it was from the get-go. And I remember talking to John, I think just I don't know, a week after it happened. We were right on it because we said, listen, this is happening. It's gonna arrive to the US in some point. We can't ignore it. So it was pretty fast for us, together with them, to start filming and documenting this event.
And we didn't think episode, we didn't think airing this. We just thought, you know, they are going through something huge. We just finished this amazing journey with these people. We can't not be there. It was just, we didn't have a game plan. We just knew we were going to be at the hospital. We're going to jump in, whatever it takes. We let go of all our team, of all our crew, because we didn't want to risk anyone. Adi was mostly by himself at the hospital, let's say probably 90% of the time. And I was cutting because we figured, you know, we need to do something like that. And we have to stay on the timeline. We don't want to manipulate. We just want to go on the timeline and try to transcend this experience that we are experiencing from our point of view as human beings, as parents, as filmmakers, together with them. So we literally didn't think Adi would go to the hospital. Nobody really knew how you can get it. So everybody was really, John was protecting him with gear and everything, and he would come back home and literally strip outside in the street, stand with his underwear, and only then he was allowed to go in and take a shower. So, you know, we also have 3 kids of our own, but we just felt it's like a calling, you know, and we really identified with them. They had to deal with this huge tsunami, and we just felt part of them. So, and later on, when we were deeply into the editing, we figured together with Netflix that this, you know, this must be aired, and then it did.
And then for John and Mirtha, what was it like to, I mean, obviously you had so much to deal with in that moment. What were the conversations like about how to sort of continue this in a safe way? And did even though it was something else to deal with at that moment, was it something you wanted to welcome, given that it would be showing what each of you were going through at that moment?
Mirtha?
Yeah, so I was it was information overload. I agree with Ruthie and Adi. We had in the emergency room, we were trying to set out protocols like on a daily basis. Things were changing. The doctors and the staff didn't know yet how much PPE we should be putting on. You know, we were all doing the same protocols and anything possible to prevent from getting it, right? You know, and it was the first time I had ever seen a patient that was really sick and family members couldn't visit. You know, a limited amount of people can go in and out of the room. So it was very challenging. And, you know, as you saw in the episode in the series, I was also in the middle of my second pregnancy. So the pressure was pretty high. I feel like that was a million years ago, but and I'm sure I probably mentally blocked out a lot of the anxiety and fear that I had during that time. At the same time, you know, knowing that I would have to leave in the middle of all of it to have my second baby, that also was a huge challenge for me. And I was torn, you know, and all of that was really captured as you know, in that series. I think the emotional aspect of it was captured. The fear and the guilt, and, you know, really just seeing, you know, a different level of suffering in humanity. It was just, you know, unforgettable.
You know, I can just say that, you know, the cameras were on the crash site before the crash happened, you know, fortunately. And you don't get that opportunity probably ever again. And it's one thing to get access to a hospital in non-pandemic times. To have access to a hospital during a pandemic, I think it may never happen again. So we knew, and David and I, because we worked together, and that's just our personality, we became so fixated on the virus, understanding the pathophysiology of the virus, understanding the elements of infection. David at Penn worked with the woman who worked on the mRNA vaccine, Kate Karikos. We were having conversations with Wuhan, China on March 6th of 2020, probably before Trump was. You can edit that. We were so infatuated with understanding as much as we can every day, and to have Adi there was so natural. It was such that, and Adi, I'll never forget giving you that blue N95 mask that was sort of soft on the inside, and it was basically like, you know, we basically looked at each other and said, you know, good luck. I got no idea what we're doing, but let's go out there and just let's capture it. And it was so rewarding. But again, it was almost easier to be in the hospital than it was at home watching, you know, Cuomo on CNN or Trump on Fox, because there is so much misinformation out there. And it was just, once we were in the hospital filming and being ourselves and being doctors and struggling, and like Mirtha said, just the fear and the triumphs and tribulations. You know, a nurse died on March 26th last year from Mount Sinai. And when he died, we all just sort of, there was like a moment of silence. The neurosurgeon from Montefiore died that same week. And that's when we really started understanding the devastation that was about to hit us.
As a way to sort of wrap up this conversation, I'm wondering for each of you, is there a moment that stands out as sort of a representation of your experience on this? Like if you think back to sort of those 2 years that you all spent sort of in each other's orbits, is there a moment that stands out for each of you? I guess we can start with Mirtha.
Yeah, so I recently got asked this question, and you know, there was I think for the second half of the series, when I come back from my maternity leave, you know, I came back as not only a doctor and a wife, but I was a mom, you know, and recording this series was really a life-changing experience for me. And when I came back from maternity leave, it was even a bigger life-changing experience because it's different after you become a parent. It really changed me personally and professionally. It gave me a deeper insight into my patients in the emergency room and the fact that I can advocate as much as I want for patients. And that's, you know, after this, I actually got involved in a lot more outreach in my community. So it was really wonderful. I got to know my patients on a deeper level for sure. You know, being in medicine, I think any specialty is always a learning process. You can, that's why I love it, because you can keep learning until the very end, until you stop practicing. Not just the medicine, but the people you're interacting with. So it gave me a much greater appreciation for that. Yeah, I think the second half of the series, after I met one of the patients that was coping with depression, you know, mental health is just such a huge component of what we do. And after the pandemic, you saw such a huge increase in health, you know, decreased resources for mental health patients. So it's another thing I'm working on also on the side to provide more resources for the mental health community. So it was wonderful learning for me.
John, how about you? Is there something that stands out in particular?
You know, one scene stands out, and it's when I'm telling Chris and Laura that his scan is terrible, and you know, you don't realize. And again, this goes back to your first question: is what was it like, essentially, to be filmed? And you don't realize. I didn't realize until I saw it when it was released. You know, how I sounded, their reactions, the father in the room, and you know, it's painful every time I see it, and but beautiful in ways that are hard to describe because of their relationship. So it's a powerful scene. I mean, there's so many for me, whether it's you know, Frank Lautenberg, who's you know, I'm standing at the foot of his bed, or Aggie Pena, who's doing a clinical trial. There are just so many. Just I can watch it because I just love just the stories and these patients. So it's just beautiful.
And for Ruthie and Adi, how about the two of you?
I think there are many. That's what I love about it. Really, if I try to, you know, scroll through, there are so many scenes that I really connect to, especially when you see it after a while. If you're still connected to it, if it still moves you, that's such a positive feeling for me as a filmmaker. You know, it's almost starting fresh. But definitely, let's say on John, you know, all his relationship with Laura and Chris was heartbreaking. You know, I was watching from the side, and I could feel the, you know, the pureness of these emotions bubbling inside of me, and it was heartbreaking. But Laura, you know, she's such a soldier, and we're in touch, you know, even these days, and it's, you know, the way that she's soldiering through. But definitely Laura and Chris, also Aggie Pena, you know, each and every one of these patients are significant for me. David had his relationship with Mitzi and Tony, who came from Tennessee, which was you know, and then he had the Brazilian girl that came in, and Mirtha. So many scenes, you know, if I see them, they're so delicate, and she's able to express, you know, the interweaving of what it means to us as, you know, people who live in New York City and who live in America, who are humans in this world. You just get this connection, you know, macro and micro so well. And Amanda, you know, with all the birth and her birth itself, which was amazing, together with her parents. I mean, we were blessed with all these great people sharing their stories with us. I think it's a bravo for them and their patients.
I totally agree with what Adi said. And I think for me, one of the highest moments was Amanda's birth, because it really manifested everything she had spoken about throughout the show. So everything she believed in and everything she was preaching was actually happening in her birth. Her encouraging people to give natural birth, and eventually she had to take the decision, and then she really wanted to be unmedicated, but then she said no judgment, and she did take a epidural. Like it was rolling her entire character and richness of the person she is just came across this birth, and it was so uplifting and moving. And every time I watch it, I sob, even though I cut it, you know, and I've seen it so many times. It's just really represent something so much larger than life, and so connected as well. Yeah, definitely Laura and Chris, for us, this scene that John was talking about, we had to take a break of 3 days to recuperate after watching this. You know, Adi was filming it by himself, and he brought it to the editing room, and we were sitting and watching the scene, and it was startling and so painful, but also so poetic as life. And it was real pain. We had to like cut ourselves from our kids and just go for 3 days to just like sort our thoughts, you know. But it's also give you this incredible perspective about human beings and about their strength. And I think what this show really does, and what we wanted to do, is really to restore the human faith, you know, in the humankind in a way, you know, because we all super cynical, and this world is super cynical. It's not that we are just romantic, you know, we're criticizing things, you know, we're filmmakers, obviously. And so all of us, this is a cynical world turned out to be. So it just felt like we really need to do something that is meaningful, and to create a meaningful dialogue with people that actually do meaningful things. You know, they actually save people's life. It's not, you know, it's not obvious. It's a big deal. So I think it's the overall, like Adi said, it's so many moments.
Yeah. Well, meaningful perspective. I think that's a great way to end this. Thank you all so much for your time. Thank you to John and Mirtha for not only being with us today, but allowing us into the work that you do day to day. And Adi and Ruthie, thank you for bringing them to us. This is a show that I really treasure, and I know that I'm definitely not alone in that.
Thank you
Thank
so
you,
much.
Steve. Thank you, Steve.
Thank you, Steve.
Thank
All
you,
right.
Steve. Thanks, everyone.
Thanks, everybody. Thanks, everybody, for watching.
Thanks
Thank
for
you.
having
Bye,
us.
Mirtha. Bye, John.
Bye.
Bye.
Bye,
Thank you.
everyone.
Bye,
Bye.
Mara. Thank you.